Hi, my name is Chris Bannon, and I'm a clinical research associate at the Institute of Metabolic Science in Cambridge. In my clinical research, I look at hormones released from the gut, and specifically I look at how levels of these gut hormones are different in healthy individuals and patients with different metabolic and gastrointestinal conditions. In medical research now, we're looking at blood samples in increasing depth. We're able to find and measure markers that we weren't able to measure before, and we can use these new markers to help us predict if a patient has a particular disease or not. Gut health is an increasingly common topic at clinical conferences and from our patients. What we do here is we're able to measure hormones very accurately, particularly ones which have been understudied in clinical research and understand their role in health, appetite, and how they can control the speed at which things move through our guts. Also, we're able to look at lots of different fragments that aren't normally measured in the hope of developing new diagnostic tests, particularly for conditions where there is no blood test. With how artificial intelligence comes into our analysis, we'll typically use supervised learning methods, such as a decision tree or a random forest. Normally, we'll know if our blood sample has come from a participant with a particular condition or if they are a healthy volunteer. With these new techniques, we get hundreds of different levels of markers in our samples, and we want to use supervised methods in the first instance to select which features are the most important to build into our model. And we will then use either a decision tree or a random forest to help predict if the sample comes from a patient with a particular condition or a healthy volunteer. A challenge when presenting this research to other clinicians or patients is they'll want to understand exactly how different markers in the blood have contributed to the model making a decision. In AI, particularly modern techniques are becoming increasingly complex, and it's not always clear how the machine has made its decision. Typically in our research, we'll focus on explainable techniques which can give visualizations such as a decision tree, which then makes it much more explainable to our clinical audience. They're able to see exactly how different markers or hormones have contributed to the model, and also it can be more understandable to our patient population as well. With the Accelerate program, I've gone on 2 of their courses, and I'm now able to incorporate machine learning into my clinical research today. AI will have increasing implications in clinical research, particularly as we use more and more modern laboratory techniques to accurately measure markers that we've not been able to measure before. But a key challenge will be to understand exactly how said hormone, peptide, or marker is important to our health.